Anosmia, the cardinal symptom of COVID-19. Hello all, I am Jahnavi Vaishnavi pursuing MBBS second year in BMCRI. Can anosmia be the cardinal symptom of COVID? Yes, it is. Loss of smell is not all or none. Varied levels of anosmia, loss of smell, and ageusia, loss of taste, have been seen in a huge proportion of the patients. Since it's not a very incapacitating symptom, most patients do not come for the checkup and end up spreading the disease amongst their contacts unknowingly. The first 10 days of the disease is very contagious and it spreads very rapidly. This can be seen in the manifold increase from March, which had only a few hundred cases, to 4.25 lakh cases as of today, that is June 22nd, 2020. Existing knowledge on anosmia. The post-viral anosmia is a prevalent symptom in 40% of the individuals as provided by the WHO. Most of the asymptomatic patients have anosmia and ageusia as the only complaint without having any other symptom of the COVID. According to Dr. Nicholas Rowan, 98% of the US, 85% of the Europe populations who have been affected with the COVID had anosmia during the course of the disease. Pathogenesis of olfactory disorders in COVID. This is due to the direct infection of the olfactory sensory neurons of the olfactory mucosa, leading to the underlying inflammation, which leads to the neurodegeneration of the olfactory neurons, resulting in anosmia. My value proposition, a clinical kit containing 3 or more fragrances through which self-test can be carried out. Low cost, easily accessible with the locally available ingredients. Endemic fragrances, for example, in India, coffee, tea, peppermint oil, and any other flowers like jasmine can be used. In Western countries, jasmine can be substituted with vanilla essence. Solution: to do a pilot project amongst normal individuals as control and COVID-19 affected patients to determine the levels of loss of smell and taste and at what period of the disease did they encounter anosmia. Also to check if there is any specific smell less perceived or lost when compared to the others. My ability to build this venture. I want to collaborate with an industrialist who is willing to take forward for manufacturing a design which is shown in the next slide, as it can be created in 2 to 3 models and include the locally preferred fragrances. It can be implemented in our country and across the globe because anosmia takes a lot of time to recover. What help I am seeking from the incubators to develop these designs shown in the figures, which can be in flip cap model or twisting model with different fragrances available as per the local condition. Or else individual sets like this can also be made. How far I have come. I have carried out sample tests with normal subjects as control using the available fragrances. I have collated the data and I have given the sample test kits to the hospital for pilot study analysis on COVID-19 patients, and I am awaiting the results for that. This is the analysis of the survey carried out with the healthy subjects on perception of smell. We can see it is segregated based on gender and the age group. 1% of the subjects were having weak perception and 6% were having moderate perception of peppermint in the age group of more than 35 years in males. This must be some stressing point. I thank my mentors who have groomed me. And thank you.